afternoon. Uh, my slides are visible?
Yes, sir.
Okay,
Yes,
thank you. So, first of all, I would like to thank the organizer for giving me this opportunity. And I've been assigned the task of discussing this abstract. This is about the combination of trastuzumab, pertuzumab, and docetaxel in patients with advanced non-small cell lung cancer harboring HER2 mutations. So this was an abstract presented at ASCO this year. It was a phase 2 trial conducted at collaborative trial conducted at France. So if you look at the HER2 mutations in non-small cell lung cancer, it constitutes around 3% of all non-small cell lung cancer, with the higher prevalence in specific subgroups like adenocarcinoma, histology, never smokers, and possibly females. Various attempts like people have targeted HER2 in breast cancer, in lung cancer also various attempts have been made with modest success, which included using monoclonal antibodies like trastuzumab, pertuzumab, and more recently trastuzumab deruxtecan and TDM1. People have tried various tyrosine kinase inhibitors like pan-HER inhibitors like afatinib, neratinib, and more recently, novel HER2 tyrosine kinase inhibitors like poziotinib. So, if we look at the HER2 mutations which occur at the tyrosine kinase domain, are mostly the most common ones are at exon 20, and mostly they are the insertions. In this trial, they have aimed to basically prospectively evaluate the combination of two monoclonal antibodies, trastuzumab and pertuzumab, along with chemotherapy. So this was a trial design. Patients with advanced non-small cell lung cancer harboring HER2 exon 20 mutations or insertions who were previously treated with good performance status were included. So they gave, in cycle 1, they gave pertuzumab at 840 milligram, trastuzumab at 8 milligram per kg, and docetaxel at standard dose of 75 milligram per meter square. From second cycle onwards, which was every 3 weeks, the pertuzumab was changed to 420 milligram, trastuzumab 6 milligram per kg, and docetaxel standard 75 milligram per meter square. Treatment was continued until disease progression or dose-limiting toxicity. The primary endpoint of this study was objective response rate, with secondary endpoints being progression-free survival, overall survival, and the safety. This was the trial outline. Patients, they screened around 47 patients, and one patient was excluded because of deterioration in general condition. Finally, in ITT analysis, they included 46. One patient did not receive treatment because patient refused to participate. And they had 45 patients in the safety and full data analysis. If you look at this patient profile, most patients were female, almost 70% were females, and more patients were actually non-smoker, as you can expect that HER2 mutated patients, mutations are more common in never smokers. Majority patients had received only one line of treatment, almost 74%, and there were patients who received more than one line of treatment as well. Almost 1/3 had brain metastasis, and most patients who had HER2 positive were PD-L1 negative. PD-L1 more than 50% were there only in 3 patients. So what they achieved with this combination was an objective response rates of 28.9%, and these responses were durable. Median progression-free survival was 6.8 months, and median overall survival was 17.6 months. The combination was reasonably well tolerated, and grade 3 to 4 adverse event, all adverse events were observed in 64% patients, but there were no discontinuation because of the treatment side effect. There was one sudden death observed which was attributed to related to treatment. And most common more than grade 3 treatment related events were neutropenia, diarrhea, and anemia, although there was no pulmonary or cardiac toxicity observed in this particular trial. So to summarize, this triplet of trastuzumab, pertuzumab, and docetaxel has activity, in HER2 mutated pretreated non-small cell lung cancer patients with an objective response rates of 28.9% with a duration of response 11 months and progression-free survival of 6.8 months. The toxicity profile of this combination is acceptable, and this requires further evaluation in further randomized trial. Thank you very much.
Thank you very much. Next, I would like to